Hi, I'm Dr. Judy Wesolowski. I'm a board-certified OBGYN, and I would love to talk to you about preconceptual care. Many people talk about prenatal care, which is care while you're pregnant, or postpartum care, which is care after delivery. I want to back that right up to before the start, before you're even thinking about conceiving. This makes it easy for me because at that time, I only have one patient. Once you're pregnant, I have two. There are many things you can do beforehand to improve your health. Now, I know not everybody is considering pregnancy, but a lot of what I'm going to go through today is good health advice. When I was creating this topic, I found that it was incredibly huge, so I may tend to move quickly. If there is something you're interested in, pause the video, screenshot it or snip it, and talk with your doctor about it. You ready? Let's go. All right, so the three major goals of preconceptual care are identifying risks, educating mothers, and integrating interventions to decrease those risks. As many as 2/3 of women do not plan for pregnancy. Of the 1/3 that do, 70% say they eat more healthy, and 40% say they save money. As many as 30% of women will initiate prenatal care at 14 weeks. This is already in the second trimester. Organogenesis, or when the baby is actually forming, occurs between 3 to 10 weeks. So we'd like to actually work before you get pregnant so we can eliminate some of the problems beforehand. Now, this is what I'd like to go through today. This is a busy slide. We don't have a lot of time. Let's get going. Your reproductive life plan. This is what you want. This is how many children you want, your optimal number, how you'd want them spaced. With pregnancies, we recommend spacing the time between pregnancies to be about 18 months to 5 years. We notice that if you have less than 6 months between pregnancies, you're at risk for having smaller babies or preterm labors. We'll give you 12 months, but 18 months to 5 years is what we'd like. Now, these are the medical conditions I'm going to go through today. We'll just keep moving. Diabetes is pretty big. A lot of people have it. And the risks to the mom are low blood sugar and high blood sugar. Both can be life-threatening. But I really want to go through what the risk to the baby is. When your blood sugar is elevated, that blood sugar actually goes to the baby through the placenta. So the baby's blood sugar is elevated. But the baby has a normal pancreas and can process this glucose without a problem. So it takes what it needs for energy, but then it stores the rest as fat. So your baby can be much larger, making delivery harder, even cesarean section. And this could cause a birth injury. The other problem is once we cut the cord, that glucose drops suddenly because the baby has no way of getting that glucose that quickly. So we worry about the baby after the delivery and have to stabilize the baby. Interventions: keep your hemoglobin A1C around 6 before you get pregnant. You can do this by adding protein to your meals. You can do this with exercise, and we'll talk more about medications. Cardiovascular disease. Cardiovascular disease causes about 1/3 of all maternal mortalities. That means women actually die, and we don't like this. And so we try to get cardiac consults beforehand to make sure that you don't have one of the cardiac abnormalities that would put you at risk for death. Asthma. One saying we use is if you can't breathe, the baby can't breathe. You both are together. So if we recommend steroids, please take them. Thyroid disease. We need you to have your thyroid at a nice level because if it's too high or too low, this can cause miscarriages and also can cause preterm deliveries. If you have seizures, your seizures might worsen during the pregnancy, and some seizures may cause birth defects. We use folic acid supplements before you get pregnant to help prevent these neural tube defects or the spine defects. Lupus. Your prognosis for pregnancy with lupus is best when the disease is quiet during the first 6 months. And then we'll check your kidney functions because we'd like them to be nice and stable also. And again, we might need to review your medications. Inherited thrombophilia. These are blood clotting disorders, and these are quite common. Now, pregnancy in itself is what we call a hypercoagulable state. That means you're at risk for blood clots. Now, put a problem on top of that like this, and you're really increased risk. So, we would really like to have you stable before you become pregnant. If you've actually had a blood clot, we'd like you to wait at least 6 months to a year before you attempt pregnancy. Now, multiple sclerosis is a unique kind of disease. Everybody is different. They have different presentations. They have different courses. And pregnancy might actually help decrease your relapses. We have some highly effective disease-modifying treatments which we can go through. Some you can use and some you can't. Another thing that we worry about with pregnancy is your weight. A lot of people think that being overweight is a problem, and yes, it can be, but also being underweight can be a problem. Underweight women tend to have preterm births or smaller babies. You want your body mass index, or BMI, to be between 18 and 30. You can figure this out by doing your height and weight, going on a computer or your phone, and looking for a calculator that'll do it for you. Here, history of bariatric surgery. This is really getting a lot of play nowadays. The weight loss can be rapid and can put the baby at risk. So we ask that you wait about 12 months to 24 months after the surgery become pregnant. Now, the good thing about bariatric surgery and why we're kind of excited about it is because the weight loss helps improve the hormonal states of your body. So people with PCO, polycystic ovary, they actually have a return to fertility quite quick. But we really want your weight to stabilize before you become pregnant. So wait 12 to 24 months. On to medications, and I can't stress this enough. Do not stop taking any of your medications before you talk to a doctor. Even if you're pregnant now, please don't stop. As I mentioned before, once you're pregnant, I have to take care of 2 patients, both the mom and the baby, and I have to weigh the risk between the 2. So don't stop anything until you talk to us. Diabetes, insulin is the preferred method. We do use metformin, especially in infertility patients, and we will continue that through the first trimester. Ozempic and the GLP-1 agonists are new on the market. People are doing well on them, but we don't have a lot of studies. It's recommended that you stop this 2 months before you try to conceive. There are some limited animal studies which are not reassuring at present. Cardiovascular disease. If you're on a statin or cholesterol medication, you do need to stop it. If you're taking warfarin, we need to switch you over to heparin. If you are asked to take a low-dose aspirin or baby aspirin during your pregnancy, please do. It's perfectly safe if you've been directed to. We've discussed asthma and thyroid and seizure medication, taking the folic acid supplement, lupus, and the thrombophilias. Again, we want to switch you over to heparin, and if you're instructed to take the baby aspirin, please take it. It's safe. Multiple sclerosis. Many of these drugs are not safe in pregnancy. That's the problem. And then you have to find one that will help you so that you don't have that many relapses, such as glatiramer acetate, interferon beta, and steroids. Megavitamins. You know, when you're pregnant, you should only take what you really need. I love vitamins, but you don't know what's in a lot of the megavitamins. So your best bet is, if you've not been directed to take it by a physician or healthcare professional, stop the vitamins and talk with one. One of the supplements that is helpful, though, is folic acid or folate. We recommend about 400 to 800 milligrams a day, and to start before you get pregnant, because this really helps with spine defects. Dietary supplements that can be harmful is vitamin A, specifically retinol. This is also found in the liver, so we tell you to limit your liver. There is some benefit to vitamin B6 because it actually helps with nausea. But if you don't have nausea, don't take it. Now we fit what I like, the nutrition, diet, and weight management. If I could manage everybody with just these 3 things and no medications, that's where I would like to be. A healthy diet for someone trying to become pregnant and someone who is already pregnant and who even doesn't want to be pregnant is the same. Get used to reading labels. You need to look at the packages you buy. You need to read the nutritional information. It'll just blow you away when you see how small a serving size really is. Also, take a look at the amount of sugar. It's amazing what they add to foods. So take a look at that, the salt, and the fat content. We do recommend primarily whole, unprocessed foods. But if you're like me, you have a job, you work, you're taking care of a house, you have all these responsibilities, and sometimes you just don't have time to prepare that perfect meal. Do what you can. Now, this is a pretty busy slide. We always tell people to eat their fruits and vegetables. Well, what we mean is eat your vegetables and only have some fruits. If you don't like vegetables, take a look around. You don't need much. It's only about 1/3 cup is a serving size, so it's very small. So if you can find something you like, something that might be green or purple, you can add it to your diet. Try to vary your diet and try to get your plate to be a colorful plate with all different colors on it. Keep to the lean meats. Another thing you want to consider is mindful eating. When you're hungry, you just want to eat. So when you're hungry, start. But as you start to fill up, slow down a little bit and think about every forkful or spoonful before you put it into your mouth. You may not be hungry anymore. You'll find that when you're comfortably full but not overstuffed, you probably have 2 little bites left on your plate. Don't eat them. They're the killer bites. They're the ones that are going to keep the weight on. Wrap them up, put them away in the refrigerator, keep them safe so they don't spoil, and then if you're hungry later, go back and eat it. Or it makes a nice snack for the next day. Sugar. Sugar is being implicated in so many diseases now. I want you to break your sugar addiction. You can do it. What I recommend to people do is look at what they're eating over like a 2 to 3 day period. Look at their empty calories. Empty calories are those that have no nutritional value whatsoever. Flavored coffees, sugar in your coffee, creamers in your coffee, sodas, chips, muffins, whatever. Then decrease it by 10%. Even pick one and decrease that by 10%. Do it for about 20, 21 days. It'll become a habit, and then you take another 10% away. And eventually, it might take a long time, but you can really break this sugar habit. Exercise. Now you're going to tell me, we talked before, Doc, I work long hours. I sit in a chair all day long. I'm so busy. By the time I make dinner and dinner's done and I do the dishes and get the kids ready, I'm just too tired. You can find 3 minutes to do exercise a day. I'm not asking for much. I'm asking you to maybe walk to your mailbox or walk to the corner and come back. And then over time, slowly increase so that you get a little bit more active. If it's possible at work, get up during the middle of the day and take a short walk and then come back. Anything will help. You don't have to be a gym rat. Yes, you actually can do too much exercise. The problem we have with people who exercise too much or too vigorously is overuse injuries. And the other thing that can happen, especially in women, is it can decrease your fertility. So if you're exercising too much and you're not getting pregnant, bring that exercise back a little bit. Substance use. You know what I'm going to say. You got to stop smoking. It is hard to do, I understand. We don't even like vaping, so you need to stop the smoking as best you can. I put the New York State Quit line up there. They are able to help you. Give them a call. The other thing that people do is alcohol. And I've heard a number of women talk about how they're trying to get pregnant, but yet when they go to a wedding, they have a couple glasses of wine, or when they are out with dinner, they have a couple glasses of wine. But seriously, if you don't need it, don't drink it, because what will happen is when you do become pregnant, you're going to think back of all the alcohol you drank and then worry about the effects of your baby. If you can't stop drinking on your own, please call us. We can help you out. Another thing I want to talk about is there's an increased rise in neonatal abstinence syndrome. Remember when we talked about the blood sugar and diabetes? Same things happens with the babies. If you're on mood-altering drugs and we clamp that cord, the baby stops getting the drugs and has a syndrome afterwards that can be quite severe. If you've tried to quit before, or if you want help quitting, by all means, talk with us. And if you are in a successful program and you're on methadone, please continue your methadone during the pregnancy. If we know you're on methadone, or if we know you're on some of these mood-altering drugs, we can prepare for the delivery to have the teams ready when the baby is delivered. Naloxone is Narcan, and there have been some studies which say this might affect the baby. But if you're overdosing, or if you see someone overdosing, give them the Narcan, because if we don't have a good mom, we're not going to get a good baby. Vaccinations. The two in particular I think you need to be tested for is varicella and rubella. If you contract these infections while you're pregnant, they can be detrimental to both you and your baby. So we would like to vaccinate you well beforehand. Rubella, we want at least a month. Varicella, we want at least 3 months. Sexually transmitted infections. Yes, this can be one of the causes of infertility, so yes, go be tested and be treated. I want to mention HIV in particular because if you are HIV positive, we can give you medications that bring the levels of the virus down so that your baby is not born with HIV. This is very possible, so please seek treatment. Family history of genetic conditions. Now this is interesting because we have some new tests out that we can test you and your partner before you even get pregnant to see if your child might be at risk for some of these. Then we can have you sit down with a genetic counselor and talk about the likelihood of you having an infant with these problems. And then you can make some pretty important decisions before you even get pregnant. Social and mental health concerns. There are a number of them out there. The one I want to address today is domestic violence or intimate partner violence. I just want you to know that you are not alone and you are not the only person who's gone through this. We have ways of helping you very discreetly. I would suggest you talk with your doctor or your healthcare provider. Pregnancy does not help these situations. In fact, we see that the violence actually escalates when you are pregnant because everyone is so stressed. We also find that children born in abusive situations either become the victims or abusers. So we'd love to help you with this. Please call us if you're having this problem. The same thing with maternal psychiatric illness. You need to be treated to have the best outcome for you and the baby. There's a lot of suffering going on, and it doesn't need to be. Reproductive history. People have problems with recurrent miscarriages. They have preterm deliveries. They have problems with infertility. This is a perfect time to talk with your gynecologist about things you can do to prevent some of this from happening. Well, I hope you gathered something from this today, and I hope you can take something away. Definitely start reading labels and try to stop that sugar. And if you have any questions, by all means, call your gynecologist, call your medical doctor, but make you the best you can be. Thank you.